Hi, my name is Palak Sharma,
And my name is Trisha Dhabulia.
and we will be talking about the sympathetic and parasympathetic system. So, I would just briefly like to say that autonomic nervous system is part of the nervous system that regulates activities of the internal organs, and this consists of visceromotor fibers. The ANS is divided into sympathetic and parasympathetic. So, let's start with the sympathetic nervous system. Sympathetic nervous system is active during times of stress, so for fight or flight, and it has a two neuron pathway, preganglionic neuron and postganglionic neuron. The sympathetic nerve roots they arise from T1 to L3.
So let's look at more on how the pre and postganglionic neurons look like. They first of all begin, like mentioned earlier, from T1 to L3, and they begin in the intermediolateral gray column within the gray matter of the spinal cord. The preganglionic fibers enter the white ramus and reach this sympathetic ganglion where they synapse. The postganglionic fibers then enter the gray ramus and reach the spinal root to go to the target organs. So, first, we'll be beginning with the cervical sympathetic system.
So the cervical sympathetic system, it consists of three paravertebral ganglions, namely superior, middle, and inferior cervical ganglions. So let's talk about superior cervical ganglion. Where are you going to find it? You'll find it right behind the carotid bifurcation. You'll find it adjacent to C2 and C3. It targets the head, the heart, and neck via hitchhiking on this carotid artery that you can see in the picture. The middle cervical ganglion, it's adjacent to C6 that targets the heart and the neck. You may or you may not find it, and if you do, it's going to be between the superior and the inferior ganglions. The inferior cervical ganglion, and when it combines with the first thoracic, it's called stellate ganglion, and it's next to the vertebral artery, which is the first branch of the subclavian artery. You can find it adjacent to C7 to C8. It targets the heart, the lower neck, arm, and posterior cranial arteries.
Moving on to the thoracic sympathetic system. The thoracic sympathetic system arises from cell bodies of vertebral bodies from T5 to T12. Beginning from T, they are first of all autonomic nerves that supply the abdominal and the pelvic viscera. Beginning from T5 to T9, we have the greater splanchnic nerve. The greater splanchnic nerve synapses in the celiac ganglion. Then from T10 to T11, we have the lesser splanchnic nerve, which synapses in the aortico-renal ganglion. And from T11, T12, we have the least splanchnic nerve that synapses in the renal plexus. All these ganglion together are called the celiac plexus, which then respectively innervate the liver, the gallbladder, the stomach, the spleen, the adrenal medulla, and the kidney. We also have nerve roots that come from L1 to L5, which form the lumbar splanchnic nerves. These inner synapse in the superior and inferior mesenteric ganglion. The one thing to consider about about these nerve roots and fibers is that the preganglionic fibers are cholinergic in nature versus the postganglionic nerves are adrenergic in nature.
Just briefly talking about the lumbar and the sacral region, you can find the superior hypogastric plexus, and that is near the bifurcation of the abdominal aorta. Uh, Also, like located anterior to the L5 vertebral body. You can also find the inferior hypogastric plexus, which lies on either side of the rectum at S2, S3, and S4 levels that also give off the pelvic splanchnic nerves. Just to briefly mention, superior hypogastric is purely sympathetic, and inferior hypogastric is a mix of parasympathetic and sympathetic. The inferior hypogastric is divided into the vesical plexus, prostatic or uterovaginal plexus, rectal plexus, and cavernous nerves that innervate the erectile tissue.
All right, just to sum it up, the main things to consider about the parasympathetic system are the three different sets of ganglia, which is the cervical sympathetic system, the thoracic sympathetic system, and the lumbar and sacral plexus. The main thing to consider within the cervical is that we have the three superior, middle, and inferior ganglions. Within the thoracic, it comes from roots T5 to T12, and we have the celiac plexus forming over there. And finally, within the lumbar, we have the superior hypogastric plexus and the inferior hypogastric plexus. Moving on to the parasympathetic system, the first of all, what we have to talk about within the parasympathetic system is that it is divided into a cranial segment and a sacral segment. So while the sympathetic system was mainly located within the thoracic vertebra, these roots arise from the cranial and sacral vertebra. The difference in comparison to the sympathetic system here is that the preganglionic fibers are much longer, as the ganglia are situated close to the target or within the target. So, first of all, we have the cranial nerves that are responsible, that provide parasympathetic innervation, namely cranial nerve 3, 7, 9, and 10. And within the pelvic splanchnic nerves, they arise from S2 to S4.
Let's begin talking about the ciliary ganglion that receives its preganglionic fibers from the Edinger-Westphal nucleus that travels with the motor route of the oculomotor nerve and synapses with the postganglionic fiber that travels via the short ciliary nerves. This provides innervation to sphincter pupillae and ciliary muscles. You can find the ciliary ganglion in the orbit, just between the lateral rectus muscle and the optic nerve. Second, let's talk about aortic ganglion. Aortic ganglion receives its preganglionic fibers from the inferior salivatory nucleus and travels within the lesser petrosal nerve, a branch of the glossopharyngeal nerve. This hitchhikes on the auriculotemporal nerve and provides innervation to the parotid and buccal glands. The location is just inferior to the foramen ovale, as you can see in the picture.
And moving on to the submandibular ganglion. The submandibular ganglion arises from cranial nerve 7. It arises from the superior salivatory nucleus and travels within the chorda tympani, which is a branch of the facial nerve. It synapses in the submandibular ganglion, and the postganglionic fibers travel directly to the target organs, which are the submandibular and the sublingual glands. When we talk about the location of the submandibular ganglion, it is located inferior to the lingual nerve. And the target organs, as mentioned earlier, are submandibular and sublingual glands. Lastly, we have the pterygopalatine ganglion, which also is associated with cranial nerve 7. It arises from the superior salivatory nucleus and it travels with the greater petrosal nerve and the nerve of the pterygoid canal. It synapses in the pterygopalatine ganglion, hitchhikes the postganglionic fibers, then hitchhike on the branches of the maxillary nerve and innervate the lacrimal, nasal, palatine, and pharyngeal gland. Location, it can be found near the within the pterygopalatine fossa. The last thing to talk about is cranial nerve 10 or the vagus nerve. The vagus nerve provides a parasympathetic innervation to all viscera of the thorax and the abdomen up to two-thirds of the transverse colon. So this point is known as the Cannon-Worm's point, which is frequently asked about. Once again, to reiterate, it is on two-thirds of the transverse colon.
So, to summarize the parasympathetic nervous system, it consists of cranial and sacral parts. The most important cranial nerves that provide parasympathetic innervation are 3, 7, 9, and 10, along with S2 to S4 pelvic splanchnic nerves that go to the inferior and the superior hypogastric plexus. Thank you.
Thank you.